Welcome to the Smith+Nephew Digital Education module on the M of T.I.M.E, moisture, which forms part of the T.I.M.E series you can access to develop your knowledge and understanding around wound care. By the end of this module, you will be able to understand what exudate is, identify factors that increase exudate production, be aware of the challenges exudate poses on patients' lives, and understand how to assess and manage exudate. The benefits of moist wound healing were recognised and practised by the ancient Sumerians and Egyptians, and there are multiple contemporary studies supporting the advantages of moist wound environment. However, many clinicians, patients and their caregivers are not aware of the benefits and continue to promote leaving a wound open to air or covering with the dressing that allows the wound to become dry. Therefore, moist wound healing education is needed to promote faster, more cost-effective wound care. You can see here a list, not all-inclusive, of some of the advantages of moist wound environment. The advantages on the left apply to the wound itself, while the advantages on the right are concerned with nursing time, cost and cosmetic appearance. In order to choose the optimum treatment in terms of moisture balance, a comprehensive wound assessment should take place. Deciding how wet a wound is can be challenging at first. Understanding what dressings are available for use is important. For a dry wound, a hydrogel or hydrocolloid product is appropriate. For low to high exudating wounds, an appropriate foam or superabsorbent gelling fibre. For those wounds that are non-healing with high levels of exudate, negative pressure wound therapy can be used to manage the wound. Whatever the treatment, the main objective should be optimising moisture balance. Dry wounds take twice as long as moist wounds to heal, and the increased treatment time increases the total cost of care. Desiccation slows cellular migration, and cells must travel downward under the scab or dry tissue to connect with other living tissue for continuing the migration process. Dry wounds are more likely to become infected and are often painful, so how should we manage a dry wound? Intervention for a dry wound is hydration, which may be accomplished with hydrogel dressings and covered with a second dressing such as a composite that will keep the gel in the wound. Hydrogel dressings usually require a change frequency of 1 to 3 days. Moist dressings may be contraindicated for uninfected arterial ulcers or for dry, stable, intact eschar on the heel of a non-ambulatory individual, as using moist dressings may result in an open wound without the needed blood supply to heal. Instead, those wounds should be kept clean and dry, protected from trauma and monitored for change. Too much wound exudate creates a problem too. Acute wound fluid contains high levels of proliferative cytokines and growth factors which stimulate activity of fibroblasts, endothelial cells and keratinocytes. However, chronic wound fluid contains high levels of proteolytic matrix metalloproteinases, or MMPs, and inflammatory cytokines which keep the wound in an inflammatory state, cause breakdown of the extracellular matrix or wound bed, and therefore contribute to delayed healing. Additionally, too much fluid can cause maceration of the wound and peri-wound skin. For a wet wound, it's important to identify and manage the cause of excessive fluid. If the etiology is bacterial burden, infection, microbial management is required. For oedema from venous insufficiency, compression therapy is needed once you have ensured there is no arterial compromise. Ultimately, absorptive dressings and/or therapies should be used to manage the excessive exudate. Examples of products to manage exudate include foam dressings, alginates, gel fibre dressings, and negative pressure wound therapy. Dressing therapy selection and/or change frequency may be modified as exudate decreases. There are many factors that will influence exudate production, such as where the wound is on its healing trajectory. For example, at the inflammatory stage of normal wound healing, or is it not healing as expected, becoming chronic or infected? Other factors include is edema, a sinus or fistula present? Does the patient have comorbidities such as heart failure? And practical factors too, is the patient cooperating with therapy, or is the wound in a particularly difficult area, for example, perineal sinus? Exudate is comprised of a multitude of substances such as electrolytes, nutrients, and inflammatory mediators. It has several functions, including aiding cell migration, enabling nutrients required for cell development, and helping in the removal of dead tissue. So it has many positive uses, and this should be remembered when devising a plan to deal with it. Having a wound, particularly a chronic wound, can have far-reaching implications for the patient, ranging from reducing their self-esteem, leading to anxiety, depression, and a feeling of isolation, to more practical issues like the loss of earnings impacting on their day-to-day lives. From the clinician's point of view, it can also be demoralising when wounds are on the caseload for long periods of time and they are unsure of the best treatment for their patient. Time restraints and the pressures of a heavy workload all lead to them feeling demoralised. In summary, effective exudate management requires the clinician to treat contributory or underlying factors and consider specialist referral, optimise wound bed preparation, remove, maintain, increase moisture balance, dressings, negative pressure wound therapy, prevent and treat exudate-related problems, peri-wound changes, enhance patient quality of life, optimal nutrition and psychosocial support. To check your knowledge and understanding, try and answer the quiz questions. What benefits to wound healing does moisture management provide? How much longer can dry wounds take to heal than moist wounds? What difference with chronic wound exudate? You have now completed this module. Take the time to reflect on how you will take some of what you learnt and apply it to your daily practice. If you are on the NMC register, then please click the link shown to access a copy of the revalidation form. Simply put the title of the session on the form and file in your portfolio. Thank you for your time today. Please remember to look at the other sections to access other modules to help you on your learning journey.